I'm delighted to introduce you to Ben Tongue, Digital Net Zero Lead at NHS England. Ben will be looking to take a step back from incremental sustainability improvements work to remind people of the bigger challenge, the health emergency. He'll be asking if we're doing enough and exploring the best pitch we can make to our organisations. So our virtual stage is yours, Ben.
Thank you very much, and very pleased to be here today. I'm going to give you a short presentation just exploring this question a little bit. So how could we focus on climate risks to help us decarbonise? Or perhaps more specifically, how could we focus on compound climate risks to help us move towards transformational change? So a little intro to me. I'm a chartered environmentalist. I've been working in sustainability for 20 or so years. I'm currently Sustainable Tech Lead in the Transformation Directorate, and I've got a real passion for systems thinking. A little reminder, the NHS definition of net zero includes decarbonisation and climate change adaptation. So this presentation is a bit of an invitation into thinking about the hidden powers of the adaptation framing. I've only got 15 minutes, so I'm just going to sketch out an idea here, hopefully create a spark in some of you. I'll share the slide set afterwards for anyone who'd like it for a full explanation. There's a lot of detail in here, and I've had to assume a bit of knowledge, so apologies for any jargon. I do hope sincerely that this is a useful contribution to today's agenda. It's a bit of a discussion piece that I hope can amplify the great work that's happening already. So next slide, please. So let's step back to 2018, the 1.5 degree report that came out from the IPCC. This was a really big wake-up call for society. It gave us a 66% chance of achieving 1.5 and the relative safety that brings from manageable climate impacts. There are some caveats in there around negative emissions technologies and tipping points. I'd recommend looking at Kevin Anderson's work if you've not done that before, if you want to explore that a bit from the Tyndall Centre. The but here is that it would require unprecedented transitions in all aspects of society to achieve 1.5 and the safety that would bring. Are we seeing those transitions? I think that's very much an open question at the moment. Next slide, please. So this is my bread and butter. This is my day job, tech and as a decarbonisation enabler. So just to briefly explore this, I do think this is an absolutely crucial pillar of decarbonisation and reaching the safety of 1.5 or certainly less than 2 degrees. So how can we reduce the tech that sits in the tech stack that enables our digital health services, looking at things like hardware and software, but perhaps more importantly, how can we use tech to enable bigger carbon savings through things like telehealth, smart buildings or digital productivity? Part of my work is building tooling to measure and reduce the carbon impact that all this has. So really important stuff. Next slide, please. But zooming back out again, we've not yet turned the carbon curve. So 2021 globally was the highest amount of carbon we've ever produced as a globe. And let's remember carbon is a global challenge. It's not a local challenge. Other than the financial economic meltdown in 2008 and COVID, we haven't seen any falls. And we've got to half global emissions from a 2018 baseline by 2030 to avoid a dangerous future. Is this still possible? I hope so, but it's certainly not clear-cut. Next slide, please. So flipping into the adaptation mode a bit now. Now we've looked at carbon. So there's a clear link here. This is not new. Climate emergency is a health emergency. Loads of amazing work by the Lancet. Countdown on this. Climate change is already happening very much globally, a bit in our country here. We're lucky so far, but it is baked in as well. We are in a damage limitation scenario. There's a wide range of issues there that you can see in that graphic around disease, mental health, respiratory problems, accidents, cardiovascular, malnutrition, etc. Next slide, please. So this is a personal summary really of how climate change impacts are going to start to grip on the health service. This is based on reading from the UK Climate Change Commission, the Lancet, World Health Organization, and others. Using a health metaphor, we can think about the direct impacts, perhaps as the illness, the second order impacts as the symptoms, and those third order impacts on how they affect us, how that illness affects us. So it's not a perfect metaphor, but perhaps it's a useful metaphor for our sector. In general, first order impacts are being relatively well managed and understood. So, things like flooding and heatwave events, these kind of things. Second order impacts become a lot more complicated. Things like supply chain security. How do we manage those risks that sit outside our own control is a difficult question to answer. Incidentally, energy security really is a kind of existential risk for my area for digital health services, so a difficult one to ponder. And when it comes to the third order impacts or the effects on us, this really kind of divvies up into two categories, so population health issues and operational issues, and is going to cause pressures on both of those. Next slide, please. So essentially that flowchart is the thing that we're trying to manage at the moment. There's lots of policy levers in place. So the green and government commitments and green plans have adaptation plan requirements and climate change risk assessment requirements. The government's green book business case process asks us to cost in a 2-degree world or a 4-degree world for longer term projects, and work out what the climate risks are and how we can manage against them. There's the BSI climate change adaptation pathways guidance as well that gives a really granular approach on that. Through the business continuity lens, we've got the emergency preparedness and response processes that deal with short-term disruption events. And the Health and Care Adaptation Report, which is on the slide here from the health system, is positioning our sector's response to the climate challenge for the next few years. That graphic on the right there is from the World Health Organization's Climate Resilient Health publications, and it essentially includes the kind of population health and service delivery issues alongside some skills and resourcing frameworks as well, which obviously are super important in terms of managing and mitigating this climate risk. Next slide, please. So tech as a climate resilience enabler, I think it's really important to recognise that tech can both create a carbon benefit but also create a resilience benefit as well. This is an agenda that I'm trying to create a conversation around at the moment. So clearly we need to make sure that the ICT and comms themselves are resilient to climate impacts and disruption, local disruption events and extreme weather and such like. The chain of connectivity needs to be unbroken. Tech UK have done some great work on that as part of the ARP reports into government. Telehealth is a really good, easy example to think about a climate resilience benefit. So it's got lots of other benefits as well, but on top of all that, it provides treatment options. So if there is an extreme weather disruption, then there's another way that someone can be helped. So there's a very simplistic example, but this, I would love to build a case study library around a broader range of these issues. If you want to see these slides again afterwards, please let me know, as I said in my introduction. Next slide, please. So the rest of this presentation is really based on a bit of reading I've done recently. So the Chatham House Climate Risk Assessment from 2021. This is, as far as I can tell, the first analysis of its kind, which starts to look at compounding climate risk, or some people call them cascading climate risks. And it's essentially an analysis of how climate risks will interact with each other. This field comes with a bit of a health warning. It's not the happiest place, so please use Climate Psychology Alliance or similar support services if you feel the need. I think it's really important as well to remember the mantra, what's yours to do? It's so easy for us sustainability professionals to try and change the world by themselves, and clearly that's not going to happen. So what's our own little contribution is a really important question here. Next slide, please. So taking this compound risk into account, my flowchart starts to develop a bit. This is an amalgamation that I've done of the Chatham House risk flowcharts that you'd find in their risk assessment online. The red arrows are the compounding feedback loops. I think, first of all, it's really important to recognise that there's a multiplier effect between population health and operational impacts that really needs managing. And then these will link into further feedback loops. So things like emergency responses like COVID created loads of extra waste from materials to respond to it. And poverty will enhance health inequality, and wider societal stresses will reflect back into health system stresses. I think that risks will become a bit more emergent, i.e. a complex system and unpredictable. Could they overwhelm the system? I don't know, but it's something that we need to think about. Could this threaten the NHS's sustainability and the kind of normal definition that the sector uses for it? Possibly. Tech solutions, my hat, will potentially provide a way to predict and respond to fast-moving risks that are local and agile. But this is a situation we want to avoid. We don't want to have to be thinking about this space. So let's not. Let's move on to the next slide instead. So other organisations have started getting their teeth into this, like the UN, the IPPR, a think tank, have started looking at what would it mean to respond to in the age of environmental breakdown. So this report, We Are Not Ready, looks at policy making in the age of environmental breakdown. It looks at how to create a sustainable, just and prepared society, similar to the UN's call for transformational change. Transformational change, I would argue, for us, links up siloed objectives, decarbonisation, health equality, prevention, levelling up, a bit like James's example about air pollution. It's a great example that looks across silos. Next slide, please. And why would we want to link agendas? I think a really important thing for us to bear in mind as people working in the net zero space is that we can create much more compelling cases for change if we can link agendas and make our programs deliver positive outputs for different teams looking at different priorities. So there's lots of great practice out there for doing this. There's the Capitals Coalition is arguably the gold standard for me. It looks at how to kind of create total value business decisions, looking across the broad sweep of sustainability considerations. Yorkshire Water are doing an amazing job at that as a Crown estate. So if you wanted to have a look online, you could find that. Other little examples, NICE have just started doing sustainability assessments as part of their broader suite of assessments that they do on their recommendations, really crucial. And the Green Book provides us a mechanism for doing multi-criteria decision making. So they give us a process for doing this stuff. Next slide, please. So I think this perhaps is the most compelling and inspiring example of a method, of a vision for linking systems. So within the wide suite of the sustainability definition, the donut economics, if you haven't read it before, I would thoroughly recommend it, looks at how to create a societal foundation across a suite of societal metrics within an environmental ceiling. So not going into environmental overshoot. Essentially, how can we create a long-term sustainability in our society? It's got lots of practical applications. There's a lot of people playing with this model already, looking at how we can start to use it on a local level. Leeds City, where I'm from, are doing it. Cornwall County Council do it at council level as well. So I think it's this kind of approach could bring us a real enhancement to the innovation that we're looking to deliver to the world. The NHS's really aspirational carbon reduction targets should bring innovation that drives wider benefit for the world, because we're allowing other people to ride on our coattails a bit. If we can take an even broader view, what more could we do? How could we amplify and enhance our work even more? And then those words down the middle, those are the chapters of the book, incidentally. But essentially they create a positive transformational vision for the future that solves for the root problems that are driving our climate crisis today. So things like fossil fuel addiction, infinite growth on a finite planet, disconnection from nature, isolation, these kinds of things. Next slide, please. So this is my final slide. And this led me to my question, really, which is like, how can I create a more transformational outcome within my work by aiming to solve for root sustainability problems? So yeah, here's a few practical examples that I hope kind of bring home this kind of quite big picture theoretical narrative that I've given so far. So how can I correct for financial externalities that aren't accounted for in our normal financial decisions? Well, we can use the Green Book, which does that already. It's amazing. And it costs in all the negative environmental impacts into our options appraisals. How can I de-silo or link sustainability to other objectives? The Tech Code of Practice does that. So it balances all those things you can see there in the tech service design space. How can I work more around the equality agenda, which really crucially links into things like the just transition and climate justice, where we can design for health equality for digital systems through digital inclusion. Really important as well in terms of the government's levelling up agenda. And it'll help our digital systems, which should create carbon benefits, scale, which is super important. How can we decouple economic growth from energy and material use? We can look to circular economy projects. So, and that's written into the the HMG Government Sustainable Technology Strategy for 2020 to 25. So a really practical example there is, how do we start to make it that we get multiple usage lifetimes out of all our bits of ICT kit, because most of the impacts are embodied in the life cycle stage, in the manufacturing stage. And then finally, how can we create more connection to nature and community? Well, I think the prevention agenda does a great job with that. So, you know, in the tech space, how can we do tech-enabled social prescribing, hopefully in natural environments and healthy living apps and things like that. So there's lots to do there. But essentially it's storytelling. It's about how can we start to link the great work that we're already doing to create a really open discussion about how that it solves some of our deeper problems that we've got to face. Last slide, please. So there's my email. Thank you very much for listening. It would be great to explore this kind of angle a bit more with people who are interested, to think about how we can use it to amplify the great carbon reduction work that's happening already. I do hope it's been a thought-provoking story for you. I think stories have a unique power, and our sector has a unique reach into UK society. So I'd just like to finish there, and thanks again for listening.
Well, thank you very much, Ben, for discussing such an important topic and explaining the challenges which lie ahead so eloquently. And also thank you for saying that you're going to share your slide deck. I'm sure many of the people watching today will really appreciate that. So it's time now to move on to our final debate of the day, decarbonising medicine. Pharma accounts for 25% of emissions. Two of the areas currently in need of intervention are anaesthetic gases, 2% of total NHS emissions, and inhalers, 3% of total NHS emissions. Optimising prescriptions, substituting high carbon products for low carbon equivalents, and improving production and waste processes have all been identified as areas for improvement. Do stay with us for this panel discussion as our expert speakers discuss current and new innovations in how the health sector can reduce the carbon impact of medicines. So to help us navigate this topic, our panelists are Tracy Lyons, Medicines Optimisation Pharmacist and Pharmacy Sustainability Lead at Poole Hospital. We have with us Dr. John Hickman, Consultant Cardiologist at the Royal Surrey County Hospital and St George's Hospital. Peter Morgan, Medicines Net Zero Assistant Director in the Commercial Medicines Directorate, and Tom Daniels, Clinical Lead for Environmental Sustainability, University Hospital Southampton NHS Foundation Trust. And this is our final panel. My computer still says it's testing my internet quality. So I'm not seeing you as clearly as I'd like to be seeing you all, but welcome to you. And Tracy, I thought we'd kick off if that's okay. Is not being done to decarbonise healthcare?
Hello, first of all, welcome. Thank you so much for having me.
Pleasure.
I guess the way that I see it is that it's never going to be enough. We're in this race against time to tackle climate change, and we're all doing as much as we can in our own sphere of influence. So with regards to medication, there's always to do, but I guess the positive side to this is that England is actually, I've got a message, sorry. Okay. No, England's actually leading the champion everything that's been done at Greener NHS, and make sure that the message gets across. The message gets across to every single member within our team. It can't just be, you know, the green person within a department that's incorporated into everything that we do.
That's fantastic to hear that we're leading the way on that front. I didn't know we were, so that is something to be celebrated, and perhaps to get the message out to a wider audience on that front. John, let's bring you into the conversation. What are the main issues in theatres and anaesthesia?
Yeah, so I'm an anaesthetist, not a cardiologist. The slight error was probably my error.
I thought that was interesting, because as I looked at your questions, I was looking forward to talking to you as an anaesthetist, because we have a bit of a theme with anaesthetists in these conferences. And to be honest, as I read that introduction, I thought, I don't remember having a cardiologist with us today.
I did correct it, but it seems to have slipped through the net. So I'm an anaesthetic registrar in Bristol, and I'm also training network lead for a sustainability network that we have here. So yeah, very much an anaesthetist. So do you mind repeating the question again, please?
Yeah, I just wondered what were the main issues in theatres and anaesthesia, and where improvements can and are being made.
Yeah, so it's been quite an exciting time in sustainability since around sort of 2017-18. It's really been brought into focus, and as your introduction stated, a huge amount of, or relatively huge amount of acute trust carbon footprint comes from anaesthetic gases. So those anaesthetic gases were the sort of the first target, number one, as it were, and that was focusing on the gases that we use to keep patients asleep. They're very potent greenhouse gases and cause warming of the surface of the earth, and contribute to global warming. But there are other alternatives. So in the sort of 2017-18 timeframe, a huge amount of work has been done nationally, locally, driven by individuals on the ground, but also our college and association, looking to quite significant and drastic reductions. There's one anaesthetic gas in particular that is really very harmful, significantly more so than the others, and that's desflurane. So it was very, very simple to implement change management strategies to stop people or encourage people to stop using it. And if they were going to use a gas, using an alternative one. And it's varied across the country. Some places have removed that gas completely. Other places still have it with significantly reduced usage. And I think some of the difficulties that we're facing are some clinicians feel that there is clinical benefit, although the evidence to support that is not very solid. Changing a culture of practice is going to take some time. So while some places have removed it completely, others haven't. Another anaesthetic gas that is sort of a low-hanging fruit, as it were, is nitrous oxide, or many people would know it as gas and air, which is a mixture of nitrous oxide and oxygen. So nitrous oxide is another potent greenhouse gas. It's actually significantly worse for the environment than desflurane. And the reason that is because it has a tropospheric lifetime. So it hangs around in the environment for sort of over 100 years, meaning that it sort of multiplies its global warming effect. This has been tackled in the last couple of years. So the Association of Anaesthetists and the Centre for Sustainable Healthcare, which is a national group, have done a huge amount of work tackling the nitrous oxide problem. So each year there's a sustainability project at a national level. Last year, this was the nitrous oxide project. And essentially, there's pipelines running through hospitals, and generally speaking, they're very old, and unsurprisingly have holes in them. So that means that there's significant amounts of this gas is just leaked into the atmosphere. And in my local hospital in Bristol, we found that less than 1% of the nitrous oxide that arrived in the hospital was actually reaching the patients, and most of it was just vented as waste to the atmosphere. So a really big issue.
That's extraordinary. I didn't realise until we did a panel specifically on anaesthesia just what a big problem it is. So it's really encouraging to hear that you're making progress and looking at alternatives. Just want to bring Peter into the conversation. Hi, Peter. I'm just wondering how you're approaching the medicines challenge.
That's a good question. So I'm, again, in the same way that for John, I think the sort of introduction bit, so it's the Commercial Medicines Director of NHS EI. So I'm kind of heading up the Medicines Net Zero work stream of the Greener NHS overall wider programme. And we're kind of seeing seeing our work program in sort of 4 key areas. So I think we've already discussed anaesthetics and inhaled gases quite extensively in this call. We're also looking at inhalers, like you said, because them themselves, the propellants have global warming potential of those. So we're looking at using more environmentally friendly, but also the key aspect of that policy and the key aspect is shared decision making with patients to do that, but actually improving expert care, because we know patients who are well controlled are better for the environment themselves. So it's not always about switching to an inhaler that's better for the environment, and making sure that they themselves have the best control that they can to be more environmentally friendly. Kind of the other 2 aspects, one of them is around supply. So how the medicines themselves, how environmentally impactful or harmful they are. So it can be working with pharma companies, both using our formal levers in terms of procurement and our informal levers, both celebrating good practice and sharing good practice that pharma are doing to reduce the environmental impact of medicines before it gets into our system, into our healthcare system. And then sort of finally, the last little bit is what we're calling, our other section, our demand section. And a really exciting piece of work that we've just started looking at is the different models of how we can carbon footprint medicines. And the idea for that is kind of using that, the NHS branding and the influence that we have nationally, as we already said, we're sort of leading the way on this, is to see if we can get some sort of international recognition that there is a sort of best method or methodologies for use within a certain setting or environment, whatever that might be. So we're all sort of working from the same playing field, so we can sort of compare different medicines or different uses of medicines in the same sort of way to start getting comparisons. And then sort of from that, identifying our sort of key next priorities, our key next areas that we can work on, whether that be a certain medication or a certain aspect of the supply chain. So it's sort of a new field that we're working in, but a really exciting area.
Tom, I'm sure you're itching to talk about inhalers, but before we talk about inhalers, and sorry that you're last on my list, somebody has to go last. Does every hospital have a lead for environmental sustainability? And how did you come to be appointed as that at your hospital?
So thanks very much, and thanks for the opportunity to join this important conversation. And I guess first I'd like to congratulate and welcome Greener NHS's contribution to all of this. They're really a fundamental part of what we're trying to achieve. And as we heard about earlier, it's all about, it's so important to have structural change as well as just individual actions. I think it's important to see it both as a top-down solution and a bottom-up solution all at the same time. And Greener NHS's leadership in this is fantastic in terms of providing that systemic change. But I also think it needs to be winning hearts and minds with staff across the NHS. With 1.3 million staff, not all of those are going to feel as strongly and as passionately and be as well as informed as the people talking on this panel, or even the people who are enthusiastic enough to join this webinar today. So I think it needs people who connect with the rest of the staff, who are passionate, to show them ways in which in their specialist clinical area they can make changes. People in the NHS provide a fantastic clinical service and are rightly proud of that service. Sometimes they can feel challenged in a perhaps a way that's not necessarily positive if they're told they've got to change something. So change is very difficult, but to engage with them respectfully, understanding the pressures of their service within your own trust or organisation is the first step to really understanding how to harness their often great enthusiasm for environmental sustainability and to therefore allow them to make changes from the bottom up as well. So I think that top down and bottom up approach is crucial. But about the clinical lead role. So every trust, my understanding is that every trust in the hospital in the country should now have a lead for environmental sustainability on their executive board. And if your trust, if you don't know who yours is, you should make efforts to find out who that is. It's not a requirement to have a clinical lead for environmental sustainability, but my view, and having done the role for a year now, I think it's quite important to have that clinical leadership. There are lots of people with the environmental knowledge, but to be able to engage with staff on a clinical level and understand their clinical pressures and the clinical opportunities really adds an extra layer of benefit. In terms of how I managed to get the role, I basically made a nuisance of myself in the trust. So, yeah.
No, I could imagine that makes a big difference. I'm sure when John's dealing with talking to colleagues about, anaesthesia, you need somebody with that clinical knowledge, don't you? I think not always, but I can see the value in having a clinician doing that role. We'll talk about people as well in a moment, but Tracy, what is next on the horizon for sustainable medicine?
So I dropped any other message before, but for me, it's all about the evolution of carbon footprinting of medications. So at the moment, it's quite a blunt tool that we have, but in the near future, because of the work that Pete and his team are leading, we're hoping to be able to have a much more precise tool at our fingertips, which will change the way we look at medication, and it'll enable us to make much more informed decisions about which particular molecule that we use. And the other thing that I'd really like to see is to look beyond carbon, because it's quite rightly our premier focus, because we need to get carbon emissions under control to tackle climate change. But we also have to be able to affect our environment, carbon emissions and the associated emissions of their use. So we need to look at how the drugs are getting into our environment, and how they're affecting it, and then try to stop that. So that would be my dream scenario for the future.
And Pete, is that coming? is that going to be a reality for Tracy?
I hope so.
Do you want to add to what she said there?
Yeah, so I kind of touched on it earlier when I spoke about sort of the demand principles of us getting a carbon footprint methodology, but kind of where we're at the moment, like we said, we are sort of really early in leading the way for this, and it can only be done sort of with international agreement on how we do it. We can't expect sort of international pharma companies to be doing different things in different ways to access different markets. It might just add in some fragility into the supply chain. So kind of what the work that we're doing is hopefully the start of the conversation that we can engage everyone with, and then quite quickly come to a solution where we can all work together for that. I just kind of want to quickly touch on something that Tom said earlier, and I think it absolutely resonates with me. So like everyone in this call talking about this, as a clinician, I'm a pharmacist by background myself, and I don't think I've sort of seen some changes to the NHS that have come through clinicians in the way that it is for sustainability, for the net zero agenda. So it's a plea to the senior leaders within the organisation to sort of allow those people with a passion to be able to make the impact that they want to make and they're trying to make. So it's the way that we're looking at our policy is sort of utilising that groundswell and that response that we're getting from clinicians and people on the ground, rather than necessarily doing, as Tom said in the past, a purely top-down approach. It's sort of enabling both of those areas to do that.
I think that's really key, and that's a theme that's come out of other panels as well, the role of senior leaders in this, in supporting the agenda. John, something else that Tom touched on was communicating to staff. I presume there's a lot of exciting change happening in your world. How receptive are colleagues and people in your departments to change? How are the new ideas going down among people who have perhaps been around a long time and have been using some of the gases that you talked about that we realise now that probably need phasing out?
And I think sustainability across the board at home.
Sorry to interrupt. Will you just start again, because your sound dropped out at the beginning?
Not a problem. Yes. So I think everyone's quite excited about sort of the topic of sustainability and very receptive, largely because people are already doing it at home. So simple things like recycling, people are already doing that at home, and equally you wouldn't leave your lights on. When it comes to changing practice, I think it's very majority are very receptive and very keen to support environmentally aware work where possible. There are no doubt the minority, I would say, of clinicians who would be reluctant, and I think that's completely understandable. If you've been using X drug for 30 years, to then change in the last few years of your practice could be something that some people wouldn't want to do, but that's where sort of engagement and discussion, and our experience is that everyone's been very receptive.
Tom, I just wondered if you've got any tips about how you get staff interested in stuff outside of their usual and very busy clinical schedule.
So actually, we've adopted a model that's been working well recently, whereby we offer them, we offer staff who make contact with us or we're aware of a walk around from myself and our estates clinical, no, our estates environmental sustainability lead. So he's got the the environmental academic background, and I've got a clinical background, and the two of us nicely overlap and complement each other's skills in engaging with clinical staff about their clinical environment. Now, I can talk about the clinical pathways, about communication with staff and testing, and he can talk about energy use and waste management. And out of those about hour-long conversations fall a whole raft of ideas that none of the three of us could have thought about on our own, but we sort of bounce ideas off each other, and it's working really well at the moment. Actually, it's a very satisfying thing to be doing.
I bet it is. Tracy, we talked on there with Peter a bit about the role for senior leaders in healthcare. What do you see as the important role of senior leaders in all of this?
I would say in my experience, it's if they're not aware of the issue, to talk to somebody who is, say, like Tom, or a sustainability manager, and then to provide leadership roles to actually explain to everyone else that this is important. And I think what we really need to get across is it's just not some other strategic action. This is fundamental. The best leadership examples I've seen are the people who stand up and explain that, and they relate it to the people who are working within their team and explain how it's a health issue, not just a political or environmental issue. It's a health issue, so something we can all tag into, and then allow all of the really enthusiastic, sustainable leads within their organisation to do their thing. So to allow John or Tom to say their piece and change services, and bring everyone else along with that enthusiasm.
Absolutely. Tom, which areas of prescribing would you say have the biggest impact on the climate emergency?
Thanks, Anne. So there are a couple of, could I just make a couple of points in response first?
Sure.
First thing to say is that in terms of helping to change minds, I think the Greener NHS's work around providing case examples of other places that have made changes in a satisfactory way. So, for example, weaning anaesthetists off desflurane, and how actually that can work in the situations that other hospitals, other clinicians might be concerned about, is a really practical way forward to reassure the sort of laggards in the change cycle. And the other thing I'd like to emphasize is the sort of triple bottom line that people talk about. A lot of the changes that we're talking about aren't just beneficial environmentally; they often also benefit benefit patients clinically, and also help the trust's bottom line. Often it's reduction of waste and unnecessary testing, for example, that reduces NHS costs. So there are multiple layers to the win, if you like. But in terms of other areas that have particular benefit, areas which we should be focusing on, my area obviously is respiratory medicine, and respiratory inhalers are, like anaesthetic gases, particularly potent greenhouse gases, and a move away from the standard aerosol devices, MDIs, by default, is a really important part of becoming more sustainable. And that requires culture change across clinicians and patients. And it's very challenging to do, but I think with the help of Greener NHS, I can see that we are starting to shift in that direction.
It's funny because when we started these conferences, the anaesthetic gases and the inhalers came as a bit of a surprise to me, and I don't know why, but I didn't realise there was such a massive impact. And what is out there on the market for people instead of the traditional we're all aware of? Do they still look the same, Tom, but just not with gases that are damaging, or is there a different kind of medication to replace the inhaler?
Yeah, there are different types of medications. The one that's been around longest is the dry powder version, so that patients having to suck on the delivery device to get it to deliver the medicine to their lungs, rather than having to coordinate the pumping action. And some other countries around Europe use much more DPI than we do, dry powders. with better outcomes from asthma as well. So that's an example of the win-win situation. Probably better for patients, less exacerbations, less admissions to hospital, better for the NHS because less admissions to hospital, and better for the environment. So that's one of the main pushes to move in that direction. And there are other devices as well.
I cut you off as you were about to say another point. I cut you off with my inhaler question, so do carry on.
Actually, I was going to ask Pete. Actually, I just wanted to hear from Pete what the the NHS is essentially a monopoly in healthcare providing in the UK, and how much leverage does that give you and us over pharmaceutical companies? You describe them as multinationals, but in fact, the NHS must be, if not the biggest, one of their biggest customers in the world. And how can you use that to leverage more change more quickly?
That's a really good question, Tom. I think kind of how and when we kind of engage with pharma and suppliers is a really interesting question, and something that we're working kind of through at the moment. So we're a bigger single point market that you can get. The way that medicines are generally procured are done at a single point for secondary care, but for primary care it is done by individual pharmacies or groups of pharmacies or larger suppliers of pharmacies. So while we are a big market for them, we don't necessarily have all of the formal levers over all of the procurements of all of the medicines. But the NHS is a big brand in itself, and we can use that to its advantage. We can celebrate and share good practice by pharma. So we have those sort of formal levers where we can say, for secondary care, when we're procuring the medicines, we expect you to do these things. And there is a greener NHS supplier roadmap that has been published, which we're also following along with pharma and medicine suppliers. But then there are also those informal ones that we've spoken about. So actually bringing them together, getting them to share best practice between each other, making it an environment where it's not necessarily fully commercially beneficial and therefore something that they keep behind closed doors, but making actually better sort of as their duty as citizens, as their duty to shareholders, that they'll want to see them progressing this agenda as well. So it's really about making that environment where it's an open and sharing thing that we're all benefiting in terms of the environmental impact of them.
Tom, does that satisfy your?
It's good to hear that some of those things are going on in the background, and that the NHS is trying to use its heft to push these big companies in the right direction. Yeah, thanks.
Yeah. John, we're drawing to the close, John. But what can we all do to help achieve net zero?
Was that me?
What can we all do to try and help net zero? We've talked very specific fields, but there's a much bigger picture there, isn't there, that we can all be part of?
Yeah, definitely. I think, as with all things, the key is sort of being passionate and talking to colleagues, friends, educating where possible, and identifying areas which you can have an impact on, and considering how that could be spread more broadly, and trying to think in a slightly more broader context as well.
And Tracy, what would you most regret about not achieving net zero healthcare?
What we have to admit, it's really sobering to think, but we have to admit that achieving net zero for healthcare is one way of tackling climate change. And if we don't do that, people are going to suffer and people are going to die. But the flip side is, and the way we need to approach it is, this is our single greatest opportunity to improve health for everyone in our families and our communities. So, and I think if we didn't take that opportunity, it'd be something we would regret always. So that's the approach that I take. It's serious, but there's a positive spin on it, and that's what we need to do.
And Pete, that fits in with what we were saying today. We've got to see these targets, these net zero targets, as an opportunity, haven't we? Rather than looming targets. The narrative has to change.
Sorry, I don't
know.
Sorry,
Pete. Pete, I was just saying the narrative needs to change, doesn't it? Because this is an opportunity for good. Whereas I think many organisations, many sectors see net zero targets as a three-line whip. We have to do it. But there are many, many positives once we dig deep and get started.
Yeah, absolutely. I think that's the way that the greener NHS and the sustainable procurement teams are working with their suppliers, is actually that we know that this is beneficial for the planet as a whole, and generally we can't allow it to be that commercially beneficial always. It needs to be for that sort of greater benefit of everyone.
And final word to you, Tom, how optimistic are you feeling about your sector and the future?
Well, I've said this before in other forums, but the fact that we've just come through the COVID pandemic and made major system-wide changes at pace to save the planet from major catastrophe gives me hope that we can pull together in the same way to help avoid climate collapse. So I do see lots of signs that this is much more of a priority than it ever was before, and it gives me hope that the level of change that we really need is just around the corner.
Well, it's wonderful to have your minds on our fifth and final panel today. A massive thank you to you, Pete, to Tracy, to Tom and John for giving up your time. I know how busy you all are, and it's really great that you give your time to share your experiences, share your learnings, update us on what's happening. I think this is a really important part of it. So thank you very much indeed. Your time with us is much appreciated. And a massive thank you as well to everyone who's taken the time out to join us today. We've covered a whole breadth of challenges, opportunities and solutions as we've engaged with the topic of net zero in the NHS. Whether you're one of our excellent panelists or part of our audience who've been sending in questions throughout the day, taking the time to listen or sparking conversations with other delegates, a big thank you from the team here at NHE 365. And a thanks to our fantastic event partner, who without events like this would certainly not be able to take place. I look forward to seeing many of you at our next event on digital health, which is on the 21st of July. So please do share the word with your colleagues. This is certainly a topic that affects everyone. If you're a winner in our gamification challenge, the NHE team will be in touch with you to discuss your prize options. Separate to gamification, today's event, as you know, was CPD certified, with 1 CPD point earned for every hour of live content watched. So if you'd like your CPD certificate, then please email at cognitivepublishing.com. They'll sort it out for you. From me and everyone at NHE 365, thank you very much for attending today and giving us your time and attention. Have a great rest of the day and hopefully see you soon.